Hello, hello, hello. Hope you all are doing well. Allison, thanks for joining. Glad you are here as well.
Yeah.
Looking forward to getting started. My background, I'm in Evansville, Indiana. As people are kind of trickling in, I would love for people to maybe hop into the chat and just let us know where you are tuning in from, as we kind of watch people come in and join. Allison, where are you at in the world right now?
I was traveling yesterday. So yesterday I was in Chicago for a
Okay,
nice little conference and
great.
made it back with no problems last night. Came in right before this crazy storm that's coming across the country. And I'm outside of Philadelphia, Pennsylvania.
There you go. Philly 76ers are having a nice little run into the late postseason for NBA. So maybe you're
How
tuned in.
about all of these Philly teams lately? All of a sudden, my entire life, I've grown up as being like, oh, when are we going to win anything? And now all of a sudden, we've got teams in the playoffs. Phillies haven't had the greatest start, but you know what? They always come back around. But yeah, it's been really fun watching the Sixers. I'm sorry if we have any Celtics fans on the call, because
They're
we
healed by now.
unexpectedly took them out last week.
Yeah, yeah.
But yeah, we love our Sixers team, and oh, the Braves are fun to watch too, Charlie. I love baseball.
Uh-oh,
And
Caitlin's
hi,
Caitlin's in
Caitlin in
Massachusetts.
Massachusetts.
Yeah, see, you might have just upset Caitlin. She is now dropped off the webinar. No, I'm kidding. Good
Yeah,
to
it's I promise we won't talk about sports for long, but it is always fun to hear where everyone's from. Are we coming in loud and clear for everyone? I hope the audio is good. And like Cole said, thank you so much for taking a few minutes today. This
yeah.
is going to be a really fun conversation. We've got a cool case to share with you.
For sure. So, a couple housekeeping things. Now that I think we've got critical mass within the meeting, yes, we are recording it. Yes, we will make certain that you receive that recording. Feel free to share it with your friends, your team, your auntie, your mom, whoever wants to see people talking about asset map, income planning, move health, healthcare planning, things along those lines. And so, today we're covering off on a topic that comes up really, really often. If you are an advisor who is working with retirees, which is most advisors, right? It's a big life transition going from accumulation to distribution. There's a mental shift, there's a dollar shift, there's a lot of different things that take place and occur. And a lot of times there's this hidden retirement expense. And when we look towards planning softwares and we look towards even a client thinking forward about what retirement looks like, rarely is someone like chomping at the bit to talk about healthcare costs. Though it is a top concern, we know that, but a lot of times you as an advisor can answer, does my client have enough money? Can we reasonably make certain that that dollar amount is going to last them the entirety of their life in retirement? And then the big one after that is what's healthcare going to do to it? And so today, alongside Allison at Asset Map, we're going to talk about, how do we solve for health insurance in what I've heard referred to as, and Allison, I'll be interested in your take on this. What, I've heard it referred to as the bridge years. I've heard it referred to
Yeah.
as the Medicare gap, all of these different things of saying, hey, I'm retiring at 57, like we'll talk about in the case study today. What am I going to do from 57 to 65? I can run Cobra for 18 months, but after that, I've still got, a lot of years to figure this out. So I don't know what you've heard it referenced at, Allison, but thrilled to have you here and excited to talk about this today.
Yeah, I'm excited to be here too. And, it might not be the sexiest topic for everyone to talk about health insurance, but we hear about it a lot when we're
Yeah.
reviewing asset map reports. And why that is because, like some other topics, asset map really falls in the financial planning category. Where visual conversational financial planning. And in just a couple minutes, I'm going to share my screen and show you around a bit, along with our great case, the Carters today, that we're going to walk through. And you're going to think about if you were meeting with your clients and they were the Carters, how would you potentially help them solve this concern? What we hear a lot at Asset Map and why we hear it is when you show someone someone their entire life, their financial life on one page, and you're talking about something as important and concerning as retirement, you're able to really quickly and easily see some gaps, some opportunities, things that you can discuss with your clients. And what we like to say is you're going to uncover everything you need to talk about an asset map, but
Yeah.
we're also not going to be every solution to every single problem. We like to partner with companies like Move Health to actually provide the solution to get to where they need to with health insurance coverage, because that's not asset maps expertise. We know what our expertise is with our software, and I think you'll see that today. And then you'll be able to see that even without any kind of data integration with Move Health, you can pop right in there and help solve that problem in just a few minutes and come
Yep.
back to Asset Map and show your client, this really is possible if you take advantage of some of the credits and some of the different scenarios that you can find using Move. And it's really, really amazing to partner up with a company that once you uncover the problem and have a great conversation, you can come to a really easy, quick solution that can really get them to their goal a lot easier than they thought.
Yeah.
One thing that I found when I was prepping for this was something like less than 25% of Americans have discussed their healthcare coverage and costs with their advisors.
Bingo.
So, who are they talking to about it? Does that mean they're not talking to anybody about it, Cole?
Yeah, good question. I say it often this way. I say, your clients have a healthcare planning strategy. You might not know it, and they might not know it either, right? And a lot of
Yeah,
times it looks like I'm going to walk into retirement and maybe I'll take Cobra and I'll figure this out as it comes. It's kind of one of those things because it's not a sexy topic to talk about, and it's something that has a lot of emotion tied to it and all of those things. A lot of times clients aren't bringing it up to an advisor because they don't think that you can help with it.
right.
And so oftentimes they go, "Oh, my advisor definitely they can't help with that. I'm not going to bring this up to them." So where are they going? Well, they're going to a Google, they're going to YouTube, they're figuring it out on
Right.
their own, and that's either
Probably
flying
AI now, huh?
right. They're either flying blind or they are flying at
Yeah.
least without this idea. And so the goal being, Allison, I think so often about the reason we started Move Health, which was my in laws, right? My in laws were 59, and how nice it would have been for them to have this one page view of their entire financial lives and be able to say, hey, here's what healthcare costs, here's where they slot in, here's what it looks like, here are some levers that we can pull, and here's a team that can help. And so I'm really, really excited for today because when I see Mark and Joan Carter, I immediately think of my in laws, Brian and Linda, and I
Wow.
think of them kind of walking through this scenario and how helpful this would have been to them 5 years ago when they retired. And it's the whole reason we started Move Health was to solve that problem so advisors don't have to experience that.
That's pretty crazy, and working for a company like Asset Map, where, our CEO and founder, Adam Holt, who's a longtime financial advisor, he created Asset Map due to a need in his own practice to better
Yep.
engage his clients, have more meaningful conversations, allow them to feel comfortable enough to share with him what they have going on holistically so that then he had permission to ask them questions about their full financial picture, which brings opportunities for the advisor, but
Yeah.
at its core, it's doing what's best for the client and prospect, and that's what we're all here for. So I love that. The fact that you have a something in mind whenever you're working on your product, that it could have really been a huge game changer for family members. Like
Yep.
that's where things really hit home. And I
For
know we
sure.
all have a story like that. So really
Yeah.
cool that you shared that, Cole. And for everyone who's never seen Asset Map before, here it is. Asset Map's been around for almost 15 years now. I've been here as VP of Community for almost 9 years, which I cannot believe. It's the absolute best product I've ever worked with. And I've been in financial planning technology since college. And why do I love Asset Map so much? I think you'll start to see it. And we're not going to put you through any slides today. Cole and I were laughing. We're just going to go right in app and we're going to show you a use case because I think you'll be able to really see how this could impact your business sitting here with us today for a few minutes. So we're going to review this case together and we're going to talk about Mark and Joan, who I joke around, let's put our advisor hats on. Let's pretend Cole is Mark and Joan's advisor, and they want to come in and talk to him about, hey, we've done a good job saving for retirement. We've really, we've done our due diligence. We've contributed to our 401ks. We've got our IRAs. We've got, our debt paid down. We've done all the things we need to do to
Yeah.
potentially meet retirement and maybe even do it early. But we've got this one thing hanging over our head, which is, can we do it along with having proper healthcare coverage so we know that we're
Yeah.
taking care of ourselves? And that's what we're going to do. So, Mark and Joan are about 57 years old, and they've let us know they want to retire at about 60 instead of 65. And certainly that's a decent chunk of time, right?
Hmm.
Looks like they've got Allison and Brian. Allison is their daughter, and Brian is their son in law. And they also have Joyce Carter up there on their asset map report. You can see at the top, who's Mark's mother. Now, you might wonder, why is Joyce up there? Well, we don't know. But again, Asset Map is the greatest way to find out what's important to them and their family. And we
Mm-hmm.
like to say everybody who matters to a family financially should be on that Asset Map report. So maybe Joan is working with Joyce on a side business, or maybe Joyce has a small inheritance that she's going to be giving to Mark and Allison. We don't know.
Mm-hmm.
So everybody, this allows us again to ask questions about this family and find out how Joyce might be related to them financially. Maybe we're helping her financially, maybe it's vice versa. But everyone that matters to the family financially should be listed on the asset map report. And I can change the visual based on that person. So I can click on Allison and Mark and say, you know what? Allison is the executor and the beneficiary on all of Mark's assets. Let's talk about that. Or let's bring Joyce into the conversation. Let's see what she has to do with it. So you can pick and choose what your view is based on all of those folks, those entities, any trusts that you might have, any business interests should be listed at the top, and we can change that visual accordingly, which is an absolute game changer. Imagine you're on the phone with a client, you pop this up on the screen, and you're able to quickly shift from talking about the client and the spouse to maybe a business and a business owner interest that you have. It's a really, really great way to keep level setting with them based on the appropriate topic. But the asset map report is going to be laid out pretty specifically in order for us to kind of keep it consistent throughout our clients. We've got individual assets and incomes over on the left-hand side for Mark. And we're keeping it pretty simple here. These clients mostly have joint assets besides their income and their retirement savings.
Mm-hmm.
This can look a lot more complex than this family, but in this case, this one is pretty straightforward. So we've got Mark's income and investments on the left. We've got Jones over on the right-hand side, respectively. All their joint assets and liabilities down at the bottom. You can see they have a primary residence. They have a joint checking, joint brokerage. They've got a mortgage attached to their home. Looks like they live in Tennessee. So we'll keep
Mm-hmm.
that in mind as well, because that might impact how we talk about their health insurance. And they've each got a life insurance policy. This is a pretty standard basic client. But like I said, they've done a pretty good job saving. They don't have super high incomes, but they live in an area that, supports this, and it looks like it's all working out in their favor. A few other things that are really, really cool. And those of you that are familiar with Asset Map, this is going to help tell this story too. We've done some nice feature changes to allow you to stay on this visual and still have really important conversations about what these client wants to do. So I can use what we're calling our sidebar here and start thinking about things that I could talk to them about. They've let us know some of their major priorities. So it looks like highest priority, retirement planning. That's no surprise. That's a lot of clients' highest priority. They've got some other ones as well. They want to save for a couple major purchases. Marca's dream is to buy a boat maybe in retirement. We can talk about that.
Same,
They
Allison.
also would
I
like
can't
to,
wait to buy a boat in
you
retirement.
can't
That'll
wait
be
to buy a
great.
boat. I'm more of, the joke. You don't want to own a boat. You just want to have a friend with a boat. I'm
That's
more
right.
the, I want to be the friend of the boat owner. I don't want
Mm-hmm.
that kind of
It's a
responsibility.
great plan. It's a great plan.
So Cole, you guys can take us out on your boat
Love it.
when you get one in the future. We've got minimizing taxes, another thing that a lot of times advisors don't end up talking to frequently with their clients, but we urge them to. That's another goal that they have. And it looks like we have a couple unassigned goals. This client has recently told us that they're worried about health coverage during retirement. That's something that we're going to go ahead and shift up here to a high priority, because in that discussion while viewing this asset map report, we can change these priorities around to make sure that our client is telling us their perspective of what they want to do with us as their financial advisor. So pretty
Yeah.
cool. And this priority feature is only a few months old here at Asset Map. I absolutely love it because it's allowing you to have the conversation before trying to find any fixes for them. You're able
Mm-hmm.
to kind of prioritize and triage exactly what they're thinking prior to that meeting. Maybe we've already had our discussion about Joyce Carter and everything is copacetic. We're feeling good about the plan with Joyce, and we can actually drag that down to resolved. So you can actually have your meeting, having the asset map report right up, and you can click and drag these around as necessary. So just keep that in mind. It's a newer thing that we've rolled out, and it's a really nice way to level set with your clients.
I love it.
Another couple things I want to show you before I jump into how can we make sure they can do it with the with the health insurance game plan. I love our signals report. So once we have a really good understanding of what this client's base plan is, which we do in our asset map report, the system's actually going to go out and it's going to let you know where there are moments of opportunity for you to have discussions. Things like, looks like you're doing pretty good with loss of life. You've thought ahead about your life insurance plan. Longevity looks good. It looks like you're, at this case, we know they're close to meeting retirement, if not meeting retirement needs. You're not going to run out of money, but if you were to have a disability event, do you have a game plan for that? We're showing red. Think about a
Mm-hmm.
stop sign here, right? Red, yellow, green. When we're showing red, we're actually saying, based on what we know about you and some kind of industry standard algorithms, you might be at risk if you have a disability event and it's not covered. Are you planning on self funding that? How would you make sure that you're okay? And it's just a really great way to make sure that your clients are protected and you're having all of the important conversations with them that you need to. And the system's going to let you know what might be that good topic. So you don't even really have to do any work about it once the items are in asset map report. So really, really cool feature that you can take advantage of either at the household level, like we are here within the Carter's family, or at your whole book of business level. You can look at it as well. Send your staff members in there, say, hey, once a month, see what kind of gaps are out there in our clients' plans, and let's set up some meetings. A really, really nice way for, again, for you to uncover opportunities and also do what's best for your clients, which is, again, always the goal.
I also love Allison, and apologies for interrupting, but I
No,
love
please.
signals and I love that feature for a variety of reasons. But I had an advisor tell it to me recently, and I thought it'd be important to kind of get it out there where it's like,
Yeah.
no one walks out of their advisor's office or a Zoom meeting and leaves it with an advisor and says, "Man, you know, my advisor really rebalanced the heck out of my portfolio." Like
Yeah.
that's not a conversation point that happens. That's table stakes, right? But
Yeah.
the things that what I call those signals is an advisor reference to me as the soft side of planning, right? And
100%.
it's the pieces that are really, really important, sometimes really, really emotionally charged, and the parts that really bring out a conversation that is not just around assets. I know we're calling it
Right.
asset map, but there's more to assets than just dollars.
Yeah.
And so I love the signals. I think it's important to call out the soft side of planning. So
Oh my God, we're all about the soft side of planning.
yeah.
I am a firm believer, and I think I'm safe enough to say so is Adam, our fearless leader. Of anybody and anything can do the math. The math is a commodity, and but what isn't is your relationship with your clients, getting to know the next generation, talking about the whole family, building a relationship with the spouse. A lot of times we call them the non-CFO spouse, that
Yeah.
spouse that isn't really the financial go-to person. That is not always the husband, by the way. I've always been the CFO spouse in my family. But it's really important to get to know everyone, build those relationships, and make sure that everyone is in the loop. And that will help you retain business, get referrals, and again, always keeping the best interest of the client top of mind. So we love the soft side of planning, and that's what we're all about. So I love that. No, nobody goes home and talks about the rebalancing. You could not be more right. And I love stealing those little gems from our advisor friends because they always say it best, don't they?
Yep. Yep.
All right, so let's look at our target maps. This is our planning engine. So if you're an asset map and you want to calculate a way to make sure that your clients are making good decisions, you're going to use our target maps. And I like to play a financial advisor just on webinars and things like this. And it's a lot of fun to be able to take an approach, especially in the asset map system. It is what I like to call interactive planning. Once you're comfortable with this application, which by the way, you could get up and running on asset map in literally a couple of training sessions. It's so user friendly. You can use this planning tool or target maps right with your clients live in a meeting.
Yeah.
It's a great experience. They can say, hey, but what if you don't include this or you do include that? That's all in our what you want section. So we take an approach of what you want. That's your expenses. That's what you want to pay for at retirement. Maybe some travel coming up in the future,
Hmm.
medical expenses, of course. What you have, what do you think that's going to be? Your income, your social security, any annuities you might have, your assets. That's all going to be included in what you're paying, what you're using to pay for those what you want sections, those expenses. So I could come in here and say, if I'm live with the client, again, Cole's the advisor, maybe I'm Mrs. Carter, I can say, you know what, we can throw in that money market. Let's include that in our retirement, or let's take it out. So again, you can pick and choose what you want to show. Maybe the client says, you know what, on all my assets, I'm expecting to actually, maybe they're a little more aggressive. Maybe they say, I'm expecting to get 9%. Let's see what that would look like. Pump it up. You'll see this circle change up top. So we're able to quickly and easily, in front of the client, having confidence in our use of Asset Map, the ability to make some tweaks based on what's important to them. Or maybe they say, well, what if it's 7%? Bump it back down to 96.
Yeah.
Really easy to tweak on the fly. And then, of course, what it means. What it means is going to say, well, right now, if you want to retire at 60, let's remember our use case, right? This target map here is including the expenses with just normal healthcare expenses, not health coverage, just, maybe some extra expenses at retirement
Sure.
is then what you want. What you have, again, is your assets. And what it means here is they've actually, if they want to retire at 60, not including the health coverage they might need to cover, they're going to make it with about a $40,000 surplus. Okay,
Mm-hmm.
that looks pretty good. Got cash flow built in if you want to get into the numbers and see the spend down. We've got that for those detail oriented folks. They're making it. However, let's do a comparison. I love this. We look good. We're 103% funded. But I've also cloned this asset map because I know this client is going to have healthcare coverage problems. And I'm going to show them, you know what? You're 103% there. You have no worries if everything looks the way it does. But
Yeah.
if you want to cover out of pocket healthcare for the next 5 years, starting at 60, you actually now have a $100,000 deficit because
Mm-hmm.
you've got cost of living adjustments to include with these healthcare costs. You're going to have to be putting out a lot of money every month to make sure you and Joan are covered with your healthcare and you have no worries in that regard. So this is something we're going to need to talk about. And I've now uncovered a problem as the advisor. Really quickly and easily, I was able to add some expenses to this and say, if we're going to cover this, you're about 10% less funded than you were before we talked about these coverages for healthcare. So
Yeah.
now I'm thinking, all right, I've got Move Health as one of my technology programs as an advisor. I'm going to go into Move and I'm going to go ahead and see if I can help solve this for my client and see if I can actually get them closer to early retirement and meeting that goal without worrying about them running out of money. So
Yep.
this is where I pass it off to Cole. Cole, you're going to take this client and show us how we might be able to help them get there.
We're going to talk about it, right? So I think, so often, Allison, one of the things that gets uncovered, you know, if we think as an advisor or as a, you know, country that healthcare planning is not important, Allison, what is the standard retirement age? What does everybody target as standard retirement age?
65.
65. Why, Allison? Do you know why? It's okay if you don't.
No.
We get health coverage. Medicare kicks in at 65, right? And so when we think about healthcare planning in the United States, healthcare literacy pretty low. We have a full team of health plan advisors that spends all day with high performing professionals that are getting ready to retire. And we are explaining to partners at law firms how a maximum out of pocket works in relation to their deductible, right? Like as a healthcare literacy standpoint, the bar is
Yeah.
is really, really low.
Yeah.
And so, our job is to try to make that really easy to understand. And a lot of times, Allison, I'll share my screen here in a moment. A lot of times, an advisor, at least I'm the same way. I don't really love to talk about things I don't know a ton about. And so an advisor is, saying, well, I don't know a ton about that. I'm not really going to bring up that conversation. So, when we're doing what we do at Move Health, we empower an advisor to bring this up proactively, as opposed to Mark and Joan coming to you and saying, hey, I'm concerned about health coverage costs in retirement. What does it look like for Allison, the advisor, to say, hey, I know we're getting ready to have a retirement conversation before you've even gotten to the office or the Zoom meeting or whatever. I've already pulled up numbers. I've got accurate figures in here. I've got a resource for you. Check, 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 right?
Yeah.
So as an advisor, you might come over and after you've kind of identified the need within, asset map, and you've talked to them, hey, this is something that's going to be important to you. You might over to Move Health and you'll click on the estimator, right? And we're going to grab Mark and Joan. We don't even need their last name, right? But this is something that you as an advisor can utilize, quickly, right? So I come over, I say, hey, they're in 37011. I like to think that in Nashville, that's a Nashville, Tennessee zip code. I like to think that, maybe Joan was, working at Capital Group or was working in one of the music labels, or maybe they were just musicians, right? They were
I love that.
W-2 on the books musicians for, a bar or something. You never know, right? I like to give everybody a
Yeah.
backstory, but I like to think that Mark and Joan were musical in some, or are musical in some respect.
Yeah, I
So
think they actually had like their day jobs, but they spent most of their free time just traveling around and doing gigs wherever they could. That's what
that's
I'm
what I
seeing for Mark and Jen.
that's what I heard. I think you're right there. So, we had talked about, hey, they're planning retirement at 60. So maybe we've plugged in 60 as the age here. And we've said, hey, at their current income, what they've listed in Asset Map is what we need to bring home, take home, if you will. We had said that was around 120 grand, right? And so
Yep.
when we do that, we go, oh, wait a second, we might have a challenge, right? And this challenge being, this will reinforce a lot of the things that a client thinks about health insurance. And one of the things that I think, Allison, that you called out is, you need to figure this out regardless of your net worth, right? We're talking about Mark and Joan, and they might be, 1.2 to 1.6, million dollars in net worth fully, but they still have to figure this out. And I love planning for those people that are in that spot where they need to think about this really closely because it's really impactful. But regardless
Well,
if
hold
you're,
on. Is anybody doing the math on $2,299 a month?
yeah, yeah,
That's more, by the way. Folks, when I said they went from 103% funded in AssetMap to 93% funded, I
mhm.
did not calculate for that much. So that 10% I showed them drop would be more than 10%
Yep.
at that cost for the gold plan. And when you're going into retirement and you're getting older, you don't want cruddy life or health insurance coverage. You want good health insurance coverage,
You want it
correct?
to do, yeah, you want it to do what you need it to do, right?
Right?
And so, there are some preconceived notions that when you're going outside, when you need to go to the marketplace or what have you, that the health insurance is going to be worse than your employer coverage, et cetera. And this is why it's important to have a guide, right? That's walking
Yep.
you through this process.
But
So,
this cost is even shocking compared to what I put into Asset Map, which makes it
right?
even more impactful. Go on.
Right,
Mhm.
exactly. And I think that, to that same point, an advisor may say, "Hey, my client could spend $4,000 a month on their health insurance and their plan's fine." It's like, well, that's great, but do they have to, right? And
Right.
do we need to do that, right? And so, Mark and Jones advisor might be saying, "Hey, here's what numbers look like," and we're going to key into a couple important figures within this screen. We try to make it really, really easy for an advisor to understand and to know where the value points are, right? So you can see this big thing up here, likely not eligible for financial help, right? Well, it's $0. Why? Because we're over 400% here. Now, that 400% is a critical piece of advanced premium tax credit planning through the Affordable Care Act, right? So the Affordable Care Act marketplace, the ACA, healthcare.gov, Obamacare, all synonymous, right? All of these things play off of, the law that was written into law in 2010 and then enacted in 2014 via the marketplace. And what this means is, the marketplace says, hey, based upon your modified adjusted gross income, the federal government has earmarked dollars in the form of an advanced premium tax credit that will reduce or potentially eliminate your monthly premium, right? And you don't have to be low income in order to qualify for these. You don't have to be low income, and they're not looking at your assets, right? So there's a
That was going
lot
to
of
be my
times.
question. So I might have a question. I'm not sure if this applies to everyone, but I'm going to ask
Sure.
it because as I was putting this together, I was like, I need to ask Cole this. You just maybe answered it, but if you could just for a few seconds explain how much are assets, how much are the assets included, and are retirement assets different than non-retirement assets? And then also income versus the assets, or is it combined? How do they look at it?
Really, really good question. So, when we're talking about advanced premium tax credits, these are only going to apply to plans that are purchased through the Affordable Care Act marketplace. Now, that's one way of saying we're going to look at your income for the current year. So, if we say, hey, we're retiring at 60 years old, our income that year we expect to be $120,000, right? they're going to look at that and say, the federal government would say, hey, you're 567% of the federal poverty level. You're not going to get any tax credits. Now, the other thing that they're not asking for is they're not saying what is in your 401k and what is in your Roth and what's in your taxable brokerage and what's in cash accounts. Assets are not calculated within
Okay.
advanced premium tax credits. So, a good example of this, Allison, and I'll get to kind of playing with the numbers here in just a moment, but a good example of this is you might have someone who has a lot of losses to harvest, right? They've done a good job
Mhm.
with either a business exit or they've done whatever, and they've got losses they can harvest, and they say, well, I can make my income look like $0. You go, well, we don't want to do that. There is a threshold in which we need to be over, but at the same point, you can make your income look very, very low. So I talk about my in-laws often. They were in a position where they could keep their income, their modified adjusted gross income, very low for those gap years. And so in 1 year, they spent $11 a month on their health insurance because these advanced premium tax credits came in and said, hey, based upon your income as a 60-year-old couple in Indiana, here's what your costs will look like. So that's what we're helping folks to navigate, what we're helping advisors to understand, because it might break the plan, right? If we're looking at
That's going to break the
$2,300 a
plan.
month, it
Yeah.
might break the plan or at least makes it a lot tighter than what we would like. So, what if the advisor said, hey, we've got some other sources of income that we can pull from to keep our household income feeling like $120,000? But what if our income's actually 80 grand, right? What if our modified adjusted gross income, which can sometimes be different, and this is important why an advisor should be a part of this conversation, is you might have worked really hard to keep their modified adjusted gross income low, and then they go tell whoever they're working with on health insurance or when they go to healthcare.gov, it's 120 grand and there's no tax credits. Well, wouldn't the advisor like to take the opportunity to take advantage and help a client to save significant dollars, right? So, as an example, Nashville, Tennessee, $80,000 in income. If all we did was reduce modified adjusted gross income, we've changed nothing about the plan aside from where dollars are being pulled from, right? So, what's making up their modified adjusted gross income? Now it's $80,000. I'm from Indiana, so my math is not great. So I might defer to somebody up in the Northeast who's smarter than I am, Allison. But I think this is over $20,000 a year. And so when we think about not leaving your advisor's office and saying, wow, they rebalanced the heck out of my portfolio, they said, we just uncovered an opportunity to save 20 grand on our health insurance. And
That's
maybe,
with a difference of $40,000 in income
yeah,
to shift from almost 2,300 dollars a month to 470.
yep.
That's crazy.
It is. And a lot of times advisors either don't know that this is the case or don't know how to navigate this, or the advisor knows how, but the client doesn't. And the advisor is not talking about it because they're not, equipped to have that conversation. But you as the advisor can start this conversation. And then as an example, I talked about, being able to keep your income really low, right? These tax credits don't go away the lower your income goes. And so, maybe this person has tons of cash on hand or what have you, and their income's actually modified, it's actually 50, right? It can go down further, and you can help, again, similar to asset map, running different scenarios side by side. This allows you as the advisor to be able to run these scenarios alongside of a client to make certain they understand, hey, here's the value point. And then further, they say, hey, well, what about Medicare? What about when we get there? So we catalog all these estimates in one spot. So I can come over here and go, sure, guys, here's what Medicare might look like for us once we get there, right? In the future. And these are based upon location. These are based upon their modified adjusted gross income. These are based upon their ages, right? So if I go back to our estimate of, Mark and Joan, and I look at them here and I say, okay, we've got a $50,000 income. Let's take it back up to our $80,000 number we were kind of targeting. This allows you to say, okay, here's the number that we are targeting and we're looking at, and we're saying this is a big difference in comparison. So a lot of times, Allison, what we will see, and I love this story when I see it, is when an advisor then says, hey, client's going to retire earlier than they thought, right? Because they then go, hey, if health coverage is this and we've got this flexibility, this was kind of the big nut to crack in the plan, and how do we make certain that we're doing it? So then the next question is, well, how much earlier can we go now that we know this is a piece of the puzzle? So
I'm doing math. I'm Northeastern doing math over here, so keep going. But
I love it. We'll do the math, and then I think kind of the next key to move health, and I think is important to note here is that it's great to have good data. That's one piece of the puzzle, but it's far from all that we do at Move. And this is not an infomercial for what we're doing, but a lot of times it's how do we make certain? I think of my in-laws. If my in-laws, their advisor had good access to good data to be able to showcase this and knew how tax credits worked and all those things, they could have said, "Hey, I feel way more confident." And then the next piece after saying, hey, good data, that's great. How do I actually get help with this? Right. And so then the advisor goes, hey, great. I'm going to send you over to Move Health. They've got a full team of people that are going to walk you through, hey, there's 38 plans available in 37011. How are we going to get down to one that's got copays and one that's HSA eligible? Right. And so then from that point, I'll just showcase this. This is what one of our health plan analysis looks like, right? So your client meets with our team. They come through our process. You've got a dashboard where you can see all client progress in one place. You as the advisor can then start the conversation and we take it from there. We're the experts. We're your outsourced expert in health insurance and Medicare planning. We'll say, this is another example of a client, but here's, their monthly premium, their doctors, hospitals, et cetera. And then we do the deep dive, right? Hey, you wanted to look at a couple of different carriers. You wanted to look at a gold plan. You wanted to look at the low cost leader in your area. And we wanted to look at a plan that has a PPO, right? Well, let's look at the different costs. We key into annual financial risk and all of these things. And a lot of times when you can show someone, hey, here's what your worst case scenario on this plan looks like, they go, maybe I don't need the PPO, right? or maybe I do, and that's important to me. Is it
sure.
HSA eligible? Why wouldn't I go with a low cost plan? Well, your doctor's not in network, right? So we want to make certain we go with things. It's one thing to have good data. It's a whole different process to make certain that you're then leading through the conversation in a way that's meaningful. And so
Yeah,
our
and
team
clients are going to
internally,
think about things like the doctors they want, the pharmacy they go to, all the things that are important to them and their day-to-day life.
bingo,
It might not seem like a big deal to us as a financial professional who's talking to a client, but like they want to go to CVS. Like that
right?
is those types of things matter to people.
Yep,
And the fact that your platform shows those details, I think really must resonate with the client. So
yeah.
everyone keep that in mind. We had like some out of pocket $15,000 numbers. We had, we were able to drop our amount to a reasonable amount to go ahead and cover costs. So let's keep that in mind. I'm going to ask you a question. I see Randy had a question. Cole, do you model expenses before you share with the client? How much do you do kind of behind the scenes versus in person? And I'm going to go back and share my screen while you handle that question.
Yeah, Randy from Chicago. I don't know Randy, but Randy from Chicago, I'm glad to know you now. That's what our team will do, right? So you think of yourself building out a financial plan, we're building out a healthcare plan with folks. And so we will model those out. And a couple things that are coming as far as product that we're excited about is some of that allowing an advisor to begin to figure some of that out and do some of that work on the front end. But our team is engaging with the client, helping them to understand, hey, based upon the specific health plan in your area at these premiums, that's when we begin to model that out and do that within that health planning analysis for them. Great question.
Great question, Randy. Okay, so Cole asked me as the Northeasterner to do some math, and my math uncovered that. Let's go into the details of this target map, and then I'll do a comparison for you. So, if you remember, we were about 103% funded before any major costs were included, and then dropped down to about 93% when we did the comparison with covering, basically $30,000 out of pocket every year. So let's look at our expenses at retirement with the tax credits applied. We've got living expenses. So this is what they're hoping to bring home during retirement. We've got travel expenses from 62 to 75. They want to go spend $15,000 a year on vacations.
Let's
They
do it.
deserve that. That's great. Maybe that's their renting a boat money, Cole.
Mm-hmm.
Or maybe they're going to Disneyland once a year and going all out. Who knows? But they're going to have $15,000 in vacation money every year. We already baked in medical expenses, so let's think about these medical expenses as our out-of-pocket deductible. Does that sound good to you, Cole?
Yeah, sounds good to me. Let's do it.
All right, let's do it. And we've got pre-Medicare cost from 60 to 65 at about 3,200. But let me tell you something. My math told me that it's actually 2,800. So we get to drop it a little more,
There we
which is
go.
great. We love this for us. Okay, so I'm going to do 2,800, and this is annual numbers for Joan. No, that's Mark. Of course, my internet's going to slow down. There we go, 2,800. I don't know if it's going to make much of a difference, but hey, it's a couple $100, so we're putting it in. 2,800. Update. All right. Now we're at 101% funded. It got us back to where we needed to be because we're able to still do everything we wanted. We're able to retire. We've got the assets to cover it. We still have the checking, the money market. We don't have to sell our house. We don't have to do any of that. We are able to keep those assets for whatever we need them for. And we've got, of course, our social security coming in as well. And what it means
Hmm.
is they even still have a bit of a surplus. We were around a $35,000 surplus before when we didn't have any coverage
Yep.
to count. But now we're back at almost $20,000 buffer for us to meet our retirement goals with their expected net return on capital of what they provided to us. They think at 8% is pretty accurate. You know, even if we were to bump it back down to 7, they're pretty darn close to their goal. And this is what's so cool. I love the comparison reports in Asset Map because I can come in and I can say, new target map. No, I don't want to do that. I want to do my comparison. Where are they? So we've got all three now. We've got 103% funded, no coverage discussed. Yeah, sure,
Yep.
you could make it, but you have this, elephant in the room of having to cover healthcare.
Yep.
Jump us back down to 93%. It's good. It's definitely not a terrible result, but do we really want to lose 10% of our, retirement assets to go ahead and cover out-of-pocket health expenses? I think you said it best, Cole.
Yeah.
Advisors who might say, well, they can make it if they spend 4 grand a month. Who the
Sure.
heck wants to if
You
you don't
you
have
could.
to?
Yeah. Yeah.
And then right back up to overfunded if we go ahead and apply those tax credits. And I really think that the lesson here is, and the lesson I talk about with a lot of our partners, I do a ton of webinars with both integration partners where we have APIs shared and we're doing deep kind of connections between Asset Map and others, and also ones where we don't.
Yep.
I just showed you a fantastic duo of technology, then you don't need to send data anywhere. You can implement these two tools together and have an appropriate, valuable, super relatable health insurance retirement planning conversation with a client with Asset Map and Move Health.
Yep.
And it's a really cool combo that you can implement right away to solve maybe this gap that you might have at your firm because you don't feel like you're maybe talking about enough, or it's not typically what you focus on. And that's really what we love to do in these webinars is give you ideas that you could actually have some takeaways. You could implement something. You could think about how it might fit in your practice without
Right.
a whole lot of effort to retool everything you're doing. That's really what we love to be able to show. And I think we accomplished that today, Cole.
Yeah, I think there's so often, Allison, where there's so many thoughts here, right? But I think there's so often where it is a scenario where an advisor, is maybe investing into tools and things and platforms and technologies that, you know, aren't necessarily addressing top concerns in priority, right?
Yeah.
I think that this is one of those components where we look at the top 5 concerns in retirement, and what are those oftentimes, right? It's, do I have enough money? How am I going to make that money last? And what's healthcare going to do to it?
Yeah.
And so when you think about those concerns, these are things that you can answer those questions really easily, quickly and easily. And I think the other piece of this component here, and we'll get to some questions I see flowing through as well, is, sure, they can make it on $4,000 a month in monthly premiums. Who wants to do that? And then the other piece is, philosophically speaking, do we prefer in the tax credit scenario, right? Between $120,000 and $80,000 in income, we've unlocked a $20,000 tax credit, without cost of living having to change a ton. And if you think about the difference between those, well, guess what? Your $120,000 is now playing as $100,000 because you're dedicating all of those dollars to, paying a monthly premium for health
Right.
insurance. So would I rather reduce my income and keep that money in my, portfolio, growing
Right.
and doing those things, or would I prefer to pay it to an insurance carrier? I think I know my answer, And so it becomes obvious in some cases, but regardless of assets and net worth and all those things, it's still something you gotta figure out. And so
Yeah.
I love that I see some questions rolling through here. There's Randy. Randy, I'm looking forward to connecting with you. Steve said, is there validity to putting the full cost of the insurance with credits as the expense and a tax-free income, representing the credits so the cost is clear to them, stressing the importance of their modified adjusted gross income? We will. That's a great question, Steve. Good to hear from you. We will do that, and I see without credits there, but we will do that. Alongside the advisor, we make it very, very clear. That 400% threshold is a threshold, and if you go over it by $10, by $1, by $1 million, it doesn't matter. Those tax credits go away, and so we stress the importance of modified adjusted gross income with those clients that are kind of teetering on that threshold. We tell them, hey, we're going to touch base. We want to touch base with you quarterly to readjust and to make certain that we're not taking tax credits we shouldn't, or that we are adjusting when we need to. So it's a really, really great question. And Steve said, sorry, I meant when modeling in target maps. Does it make
No.
sense to model those different scenarios out? So Allison, I'll let you take that.
Yeah, there's definitely a couple different ways you can show it. Target maps make it easy to kind of show it. I decided to take this route, right? The route of adding the expenses. You can definitely do it a couple different ways. Our system is malleable in a great way that you can kind of tell the story in a way that reflects how you speak to your clients. So I think your suggestion and actually how Cole reacted to it as well. Absolutely. And what's great about AssetMap and a lot of, among other things, is our team. At the event I was at yesterday, someone said, can I just chat into AssetMap or can I give you guys a ring? And I know, not everybody has a build out customer support team like we do, but with AssetMap, you can call us and we'll help you with a case. Our team is awesome. Give us a ring and you can give, a bit of a scenario, almost like we did with the Carters today, and ask our team's advice on how it would be best for you to model it, and we'd be more than happy to help you. So great question. And if you ever want to kind of take a different route, just let us know and we'll help double check it for you.
Love it. That's awesome. Steve's one of the best. We love Steve. So there was a couple questions within Q&A from Al. Al, we certainly host client-facing webinars. We for our partners, we have a full list of monthly that we do between Medicare and pre-65 health insurance, where we're talking through what those are, the what and the why. And then we are pointing the client back to the advisor to route through our process, which then goes to your other question there, Al, of can consumers go directly to Move Health? What's the difference, right? I say it this way. They can do it one time before I chase down their advisor. So they come to us and they might say, our first question after that, after how are you, is who's your advisor and how'd you hear about us? We're purpose built for advisors. And so that dashboard and our tooling and resources make it easy for you to start client engagements, and then beyond starting client engagements to track progress, make certain you're in the loop, what I call in the loop at arm's length. And so glad for the question, Al. Thank you. Any other questions that are out there? I don't know if there are. Allison, we answered all of them. I think there's no questions because we've answered all of them.
Yeah,
So
I think we did. We addressed a lot, and I'm going to type in a couple email addresses in the chat. So if you guys
yeah,
want to take advantage of checking out AssetMap, if you're not a subscriber, we'll train you up, make sure you know how to use it in meetings, and I think you'll see how it's changed so many advisors' lives in their meetings. So I'm going to put in hello@assetmap.com, and I'll also put mine in there. You can always find me on LinkedIn too. But we're always happy to connect. Like I said, our team is awesome, whether it be the sales team, the customer support team. We've got just over 50 people now at AssetMap. When I started, I think we maybe had 10. We're really
so cool.
growing,
Yeah.
and we would love to connect with you and show you how you could implement this in your practice if you're curious. And I see Josie got yours in there as well, Cole.
I love it. Well, this has been awesome. I've, if nothing else, I've now updated my Rolodex, Allison. I've got a paper Rolodex where I write everything. I'm kidding, I don't. But I've now got the hello@assetmap.com. It's going to live in my Rolodex. But good to
Nice.
connect. Thank you for joining, talking about, how we can solve this problem, right? It's oftentimes where an advisor is reacting to this. And so rather than reacting, let's be proactive and look at this closely together. And so grateful to work alongside Asset Map. Happy to partner with you, Allison. And I'll
Same.
see you at the next conference as always, right?
That sounds good. Great seeing everyone today, and let us know if we can help.
All right. Thanks so much. See ya.
See ya.